want you just to lift both arms up over your head. Good, bring them back down. Hold them right there. Don't let me push you down. Okay, very good. Go ahead, make your arms like this. Okay, don't let me pull you out. Good, don't let me push you in. I really care about triceps because triceps are how folks push themselves out of bed. So that's good to know. You go ahead and touch your shoulders, straighten them back out all the way. Flip your hands up. Good, so she's telling me that if we need to kind of move with a rolling walker, she's got the wrist range of motion for that. And then go ahead and squeeze both my fingers as hard as you can. Okay, so the trick with this is only give your patient 2 fingers to squeeze. They're not gonna hurt you, but if you give them 3 fingers, they're gonna hurt you. Okay, so just 2 fingers, that's it, okay? And Allison's got great grip strength. And what I'm doing is I'm generally just assessing symmetry. There's no differences between one side or the other. Of course, if Allison wasn't a hip and maybe she had a stroke, at that point I would start breaking things down a little bit different. So I would maybe do the uninvolved side first, and then I would ask her to do the involved side, and I would see what she could do on her own, but then I would check passive as we go along. Okay, so that's just maybe 2 examples of somebody who I'm just screening for upper extremity range of motion and strength versus more like evaluating for impairment because of a new health condition. Does that make sense? Okay, now what we're gonna do is I'm gonna come over here, and I like to start with the uninvolved leg. Okay, so I'll drape my patient, and then I'll just say, okay, can you bring your knee towards your chest? Very good. Don't let me pull you down. Good. Don't let me push you up. Very good. Okay, can you hold your leg here? Okay, so this is my quad assessment. She's obviously as against gravity. Don't let me push you down. Okay, you relax. Bring your toes to your nose. Hold it. Don't let me push you down. Okay, now push into my hand. Okay, very good. And then what I can do is assess the surgical leg. All right, Allison, what we're gonna do is I'm gonna just kind of take a look at the range of motion and strength on this leg. You might have a little bit of increased pain with this, but just take slow, deep breaths. Show me what you can do. If the pain gets to a point where you cannot tolerate it, I don't want you to push past that, okay? You should be able to tolerate this movement that we're doing, okay? All right, so we're just gonna lift this leg up, and notice that I'm already like supporting her leg as I'm draping her. Okay, Allison, can you go ahead and bring this heel towards your bottom and just slide it as much as you can, and then she'll just do what she can, right? Okay, go ahead and come back out. Can you bring your knee towards your chest? And again, just whatever she can tolerate, and then come back out. And then I'm gonna have her hold it here. Can you hold your leg here? Generally, they're not gonna have great activation of the quads, so notice that I'm very closely guarding the surgical limb. Now, after OIF, there's no range of motion restrictions. I'm not gonna do passive range of motion on her because I don't need to push her into a point where there's too much pain. I'm just gonna, after a fracture, surgical repair, I'm gonna let her pain be the guide in what she can tolerate, okay? Now, obviously, if this was a total hip, then we could bring the knee to about right there, but then I'm gonna say, okay, straighten it back out because we don't wanna break precautions, okay? Or bring your leg out towards me, but we're not gonna bring the leg into breaking precautions, okay? I'm not gonna be sitting here doing rotation after a total hip, especially a posterior lateral approach. All right, bring your toes to your nose. There you go, hold it, don't let me push you down. Notice I'm applying resistance here. I'm not applying resistance to anything that attaches up here at the hip, but I'm applying some resistance here, and then she can push into my hand here, okay? All right, so at this point, MSK systems checked out. I can go ahead and do some light touch just to screen for any abnormalities there. So I would cue Allison to, okay, I'm gonna go ahead and check your sensation. I'm just gonna touch you at different points on your leg. It's gonna feel real light like that. If I had a glove, then I could do it. And Allison say yes and where when you feel it, okay? We could go through that. And then the last thing I'm doing, usually I'll do this while I'm checking range of motion and strength out, but I'm just gonna do a quick little assessment, and I'm just gonna look at the skin and make sure that there's no erythema or pain along that deep vein distribution in either legs. And then I can do like a quick little look at her heels, because that's where any kind of pressure injuries would be developing, okay? So that's, anything to add?
No.
Like,
You're just screening.
Yeah.
To get ready to mobilize them.
And you just adapt it as you go. So I gave you examples of someone maybe after open heart surgery. I would say, Allison, straighten your arms out and lift to this level. Okay, don't lift past there, because then you'd be breaking your precautions. So I'm educating as we're going. You can lower your arms back down. But I'm not gonna be pushing on anything that attaches to a surgical site, okay?
And you notice also all of your formal positioning that you all learn on how to do proper manual muscle testing. You're not, you screen it.
That's not what this is.
Yeah.
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 Now, if Allison had had a stroke and I had noticed that she couldn't do against gravity on this shoulder, then I could put her in gravity minimized to see if then she could get full range of motion. And I might go into a little bit more sensory testing if it's a patient post-stroke, because I'm trying to really define that new baseline for them. So you kind of tailor it to how they go. If someone's here for heart failure or COPD exacerbation, I'm gonna be listening to heart and lung sounds before I get them up and after I get them up. So you tailor your examination for the patient in front of you. Okay, that's an examination. Then you would go into your functional mobility. Now, let's say that Allison is here for like a multi-trauma, okay? And we have to don some medical devices before we start getting her up. Okay, so first one I want to show you guys, what did I do with that? Is the abdominal binder. The abdominal binder is gonna close like a corset around there, okay? You kind of want to position it to where it's catching like the top of the iliac crests, and then like right below your ribs, okay? That's kind of the area you're trying to get it in. All right, so what I'll do is I roll it, because I have to get it underneath Allison. Now the abdominal binder itself has to be against skin, okay? So with that in mind, I need to bring up Allison's gown, so I'm gonna use my sheet to drape her while we've got the gown elevated, okay? So I'm gonna go ahead and just keep you covered, but we are gonna go ahead and lift the bottom of your gown up. And then, Allison, in order to, and I need to elevate it like out of my way in order to get this on her correctly, okay? So everything's out of the way. In order to put this on, I'm gonna need you to roll. Now, do y'all remember what I said about when I choose log roll technique versus long sitting? When do we choose log roll technique? When it's a central problem. Abdominal surgery, chest surgery, back surgery, we log roll, okay? Allison had abdominal surgery. She had an exploratory laparotomy. She split from her sternum down to her pubis, okay? So we need a log roll, right? Okay, so Allison, go ahead and bend up both your legs for me. I want you to, can you lift your bottom up and scoot a little bit towards me? Very good. Okay, now what I want you're just moving so well after this major trauma that you've had. I'm gonna have you in kind of keeping your shoulders and your knees in line with each other. I want you to roll over towards that side. Hang on a second. I never roll a patient if I'm not here to stop them, because I don't want them to go Humpty Dumpty and just keep rolling off the wall. Okay, so Allison, go ahead and roll over onto this side. Very good. Okay, and then I've got this, I'm kind of positioning it where I need, and then you can go ahead and roll back. Very good. And now I rolled, oh, that was loud. Elliot loves doing that right now. It squeaks all around our house, driving me up the wall. So because I had rolled it, it was just a simple, like I just unrolled it and it's right underneath her. So we're gonna go ahead and tighten this up. It's gonna be nice and snug. Does that feel okay?
Yes.
Okay, feel snug? Giving you some support? Okay, good. And then I can fix her gown and put it back. Okay, so that's one device down. Now, let's say Allison also had to have a lumbar fusion.
Thanks.
Going through it. Now, I can't say I've ever seen like an abdominal corset underneath a TLSO, but let's just say Allison's just really had a go with it, right? So we have to put the TLSO on before we get her sitting up on the edge of the bed. The TLSO, there's certain things that I want to make sure I do before I get this on her. One of them is to make sure that the straps are going to cooperate with me. So I like to put all the straps on the back part. Yeah, that'll work. So it's just a little bit easier if they're on the back part to actually get her strapped in when we get it in position. And a lot of these times you're the one getting these out of the bag and fitting it on the patient. So you just want to take your time and make sure that you got it on them right and all the straps are where they're supposed to be.
And there are a lot of different kinds, so half the time when we're in the hospital, we're trying to figure out what the heck this is.
Yeah, how do you put it on them?
Because we haven't seen this exactly before, so you just have to kind of understand the principles of it and then, you know, look at the instructions and figure it out.
Yeah.
You can Google, I've Googled them
Yeah.
before.
Alright, so this is the chest piece, and then this is the piece that's gonna go on her bag. I wish I had a bedside table, but I'll just use this one over here. That'll be my bedside. This will be my bedside table. Utilize my environment. Thank you. Appreciate it. Alright, so what we're gonna do, Allison, is I'm gonna get you to log roll again. We're gonna get lots of practice log rolling. You'll be an expert about it, and you're already kind of shifted this way, so we'll log roll this way again, okay? All right, now this time the TLSO is gonna go over her gown, so I'm just gonna go ahead and move this out of the way. Okay. All right, so do you remember what I told you about log rolling?
Yes.
What's important about it?
Keep my body in line.
Very good. All right, knees and shoulders stay in line. Go ahead and roll onto your right side. Very good. I'm gonna make sure that I get her covered up back here because I don't want the device to pinch her skin or cause her any kind of friction. And then what I'm gonna do is position this to where when she rolls back, like if I do it too far over, when she rolls back, it's gonna be crooked. But the goal is for this to stabilize her spine so that when she rolls back, we're gonna land in a good spot. I think that's gonna be good. Okay, so Allison, when you roll back, push that up. You're gonna be laying on top of this. So it's gonna be a little bit uncomfortable. But after we sit up, it's gonna feel a little bit better, okay?
Okay.
Now, the other thing before I cue her to roll back is I don't want my straps to get all lost underneath her. I want my straps, I need to be able to find them on the other side of her roll. So I'm gonna go ahead and kind of try to position them where they're gonna land. Okay, so Allison, go ahead and roll back on 3, 1, 2, 3. And then as she rolls, what I'm doing is just facilitating her a little bit. And Allison, it's kind of just about the best patient for a TLSO you could ask for. Sometimes the patients, they don't land quite where they need to, so then you have to roll a little bit to the other side and position it a little bit more. But you landed really well, so good job. Okay, lift your head up for me. Oh, there we go. You can come back down. Just her pain is just so well controlled. Alright, so the chest piece is gonna go on top to create a little Allison sandwich. And then we're just gonna start strapping her in. Now, usually what I'll do is I'll tighten the straps at the same time, just so that they don't start twisting one way or the other. So I'll try to get them tight at the same time. We might be calling them and letting them know this one's a little bit too big of a size for you. Get that tight. So you'll see how it's a little bit easier for me just to feed the straps like up to the top chest piece rather than trying to get them underneath. Yeah, so that's why I started off the way that I did. This is gonna be loose on you, Allison, so
It's okay.
the fit's not gonna be great. We're just gonna really follow those spinal precautions, okay? Come around with that one. I'm not sure if I have this twisted. No, that's right. Distract. Okay, so then we're just gonna kind of tighten Allison as best as we can in this thing. But she's got her TLSO on now, okay? All right. What else should we give Allison? Oh, should give her the neck brace. We gotta give you the neck brace.
How's the other guy look?
It feels kind of nice right now.
All right, what precautions are we anticipating with somebody with this thing?
Side bending, rotation.
No side bending, no rotation, no bending, right? Or wrong, or none of them, okay. Yeah, so cervical spinal precautions, okay? So, in order to put this one on Allison, guess what we have to do?
Flex.
We have to log roll again. We're gonna put this one, okay, Allison, what I'm gonna do is I'm gonna put this on your neck, and then we'll log roll to get the back piece on, okay?
Okay.
All right, so this is gonna be a little bit snug. I don't want you really moving too much. I should have come, well, maybe I'll just have you log roll this time. Let's make you do some exercise instead of me walking all around. All right, so let me have you bend those knees up again. I'm just gonna have you scoot your bottom a little bit over there. Good, perfect. Now this time, what we're gonna do, a lot of times for a cervical patient, depending on their body habitus, you might need to remove the pillow or keep the pillow
To keep the neck in line?
to keep the neck neutral. For Allison, I think it's gonna be okay. But like if she had broad shoulders, I might keep the pillow. But I think the pillow's flat enough, we're gonna be okay. All right, go ahead, on 3, Allison, I want you to roll towards me. 1, 2, 3. Roll onto this side. You can just relax your head down. You can just relax your, no free shows, Allison, no free shows. Okay. This one's up. You didn't know what you were getting into, huh? You're never gonna be patient again. Okay, so I'm gonna go ahead and secure it, but then I'm gonna tighten it up a little bit as when she gets back to her back. So Allison, on 3, you can roll back onto your back. 1, 2, 3. There we go. Okay, and now what I'm gonna do is I'm gonna go ahead and secure this, make sure that it's nice and snug. Does that feel okay for you?
Yes.
That was a trick. If you had nodded your head, I would have said, can't be doing that. Okay, so what else? What's that? A knee immobilizer. She needs a knee immobilizer. Oh no, Allison. Okay.
Okay, so I'm videoing
I
this.
did not read the chart well. I've been having her bend her knee and I wasn't supposed to this whole time. So let's say Allison has a patellar fracture. Woo! And she needs a knee immobilizer whenever she gets out of bed. Sorry about this, Allison.
Dr. Hughes, what's the MOI here?
I-35. That's what it is. Now wait a second. I gotta make sure. Gotta make sure I've got the thigh part on the thigh part.
Sneeze real hard.
Okay. These, do you see how they're kind of like tapered on one side? That's the ankle side. And where it's wider, what is this, a trapezoid? Is that this shape?
Looks like red.
Like a trapezoid, right?
Cool.
It's longer on one side
It's a bird
and
shape.
it's shorter on the other. The longer side's got to go around the thighs. Okay? After I tore my ACL, I went to an ER and they put this thing on me upside down, and I hardcore judged them.
Did you correct them?
No, it was before PG school. I
Okay.
still knew it was wrong, but I was like, I guess I don't know. They know what they're doing. And then when I learned all this, I was like, God, they really messed that up. So I still judge them to this day. Okay. So what we're gonna do?
A lot of braces upside down.
Yeah.
Other people put it on.
So-
Correct.
What we're gonna do, Allison, is we're gonna lift your leg up. We cannot bend your leg, so we're gonna keep it straight the whole way. So let's on 3 lift. 1, 2, 3. So notice how I'm supporting her leg while I put the knee immobilizer on her. One thing about the knee immobilizers is you gotta get them, you can go lower down. You gotta get them kind of up proximally to get them in the right spot. That's another mistake you'll see is sometimes like where the knee should be, it's like down here. A lot of times you're going up really proximal on the thigh. So just make sure you're lifting enough that you're getting enough of clearance in order to move it proximally enough on the thigh. Okay. So I'm gonna make sure that this is snug against Allison's leg. She's doing a good job keeping it straight. Go ahead and lift up again for me. okay, you can lower back down. And then I'm gonna tighten it up. Hopefully I'm not jostling Allison too much. She seems pretty comfortable. She can hit that PCA button if she needs to. Alright. Now,
Stable there now with all those bubble lights.
yeah. Alright, what else? Get our boots. Yeah.
Then a 6-minute walk test.
Get her a boot. I know, right? We have sliding boards. Okay. Here we go, so I'm just gonna put it on this leg.
We need a sling.
There we go. Alright, so on this one, I just wanna make sure that the heel goes all the way posterior. That I'm getting the right layering. Oh, I'm supposed to put this thing over her. That's supposed to go over her heel. There we go. This thing has seen better days, I think. I think they gave you a used one. That's okay, it'll do the job.
It's good. It's a good find.
They do
I
have
think
them
we're
at
missing a
Goodwill.
strap
I
or
saw
two.
them last time I was there. I was like, holy what?
Good?
I think we never said.
Okay, Allison, let's sit up. Alright. So, we gotta do that log roll, okay? Actually, I'm gonna flatten you down because the log roll, if we log roll you from this position, we're gonna side bend. Should have flattened you down from the beginning, sorry about that. Okay.
Can we get some lines and tubes?
I would love it if we could go, I don't know, if you, can you scoot that way? Can you shimmy that way a little bit? You can. Okay, we're gonna go ahead and roll onto this side, okay? You don't have to bend your legs or anything. On 3, we're gonna roll. 1, 2, 3. There we go. And now we're gonna go ahead and sit up. So swing your legs off for me, Allison. Okay, sit up. You can push with your arms. That's okay. Push a little bit. Okay. All right. A little bit high. So let's lower down. You can get this foot underneath you a little bit. Not that you can just rest on the floor there.
Do we need a walker?
Yeah, very good. I don't know what the weight bearing precautions are on that leg. I might need to clarify before we get up. But that's how you don a bunch of devices on someone, okay? Not bad. We got 1, 2, 3, we got 5. Not bad.
Good job, Allison.
Okay, so with the remaining like 10 minutes, what questions do you have?
When you were putting some of the stuff on, the bed was elevated when you had it rolling. Is that okay?
Like I had the head of bed elevated. I would have ideally flattened that. If I was truly like spinal precautions, we're gonna put the head of bed flat to do log rolls, so we don't side bend when we roll. Yeah. What other questions y'all got? Okay, when we go over there, y'all are gonna be practicing with a TLSO and an immobilizer. So maybe just in the next few minutes, what I would like for you guys to do is maybe practice putting a neck collar on just to see what it feels like. And then I also have some wrist restraints that if I didn't show you how to tie a restraint on Monday, come over here and I'll show you how to tie a restraint. Or come over here, okay? All right, so like 10 minutes, and then we'll be walking over to the nursing building.
Are we supposed to be doing the chart? I thought.
Yeah, the table's to the side. So even if y'all just start filling it out, working on that, yeah.